Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapist, and the new advocate, APTA, geriatrics state advocate here in Delaware. So I am your physical therapist, also host and moderator of the Geriatric Rehab Summit. In our Balance and Fall support group, every Thursday we do a highlights. They are physical therapists, innovators, academicians, researchers. We even have one scientist and audiologist at one point. All over the world, we even invited UK and Australia, right? So right now we have another amazing physical therapist. She is based in California as a geriatric physical therapist more than 12 years. She has many certification. We have the CAA, the Aging Adult Certified Specialist, also in Otago, falls prevention, and also in Tai Chi. We know that how very important the Tai Chi for balance and prevention, right? So for tonight, we have Swathi Balantrapu, and she is based in California. She is the founder and innovator of the new Agewiser, and this is something new that will help our aging and older adults. So without further ado, we will learn more about her. Welcome, Swathi. Thank you so
Thank
much.
you. Thank you so much, Jenny, Dr. Jenny Yusuf. I am very, very honored to be here today, to be a guest, speaker here. And thanks for inviting me.
Yes, of course. It's my pleasure. You are amazing. Thank you for all you do. And I believe we met in CSM. And I see that you have an award also like for the Home Physical Therapist Excellence. What is that award again? Tell us more about it.
Oh,
Congratulations.
thank you. Thank you. So this is the award, a Clinical Excellence in Home Health
Yeah.
Award that I won for the 2024 year. And I feel like that was my first time, winning something that huge in the academy. And I'm starting to feel like I'm being recognized, and that's a great achievement. And thanks to everybody that, supported me to win that award.
Yes, that's really amazing. I'm a home health physical therapist too, and that's really a big recognition once we
Mhm.
receive that because it's really tough being home health. You're traveling different kinds of home setting, and then how did they make you like a qualification so other people will learn more about that there is an home health clinical excellence?
Yeah, sure. So I started my journey here in United States back in 2010, where I was a researcher early in my career, and I did master's in kinesiology at University of Illinois Urbana-Champaign. That's back in Chicago, very cold.
Mhm.
So that's where I landed. I did my master's in kinesiology. And after I finished, research in multiple sclerosis, that was my focus area while I was doing my master's degree there. I did that until 2013. I graduated, and then I started home health practice like in the middle of 2013 in California. And that changed and opened so many doors. And I always link my success to California. Everything has opened up, and there's a lot more opportunities that I found. And I actually never thought I would end up in geriatrics. And it happened to be like I started in home health, and ever since I practiced, my experience is a lot more in home health than in outpatient.
Mhm.
And I kind of gained so much experience seeing patients, seeing the way how I'm changing lives in patients' homes and how much education that we do. And it matters a lot. And thanks to all the clinicians out there, PTs, rehab professionals in general, what we have been doing to the community. So yeah. Um, Let me see. So yeah, I've been geriatric therapist for so long, like over now 11 years. And I started my new role, I would say, as a researcher again after, a big break after 2013, right? Again, I took up a position in Veteran Affairs in Stanford as a researcher. Right now, I am involved in chronic kidney disease, exercise interventions, and I am, designing exercise intervention, doing a randomized control trial to help improve mobility and psychological factors in chronic kidney disease patients.
That's amazing. That's why it's a clinical excellence, guys.
Thank
You
you.
are amazing. Congratulations. Just listening, I know you, we met, but I didn't know how deep, those like now I'm learning more that you also do some research. I thought you're just like more on just home health,
Mhm.
and then mobile PT, you're doing fall preventions. I remember that you're
Mhm.
using Tai Chi and more on balance training, and of
Mhm.
course taking care of our aging and older adults. But that's really new for me, like the research in Stanford and veterans,
Mhm.
also like the chronic kidney disease, more on those interventions. So that's really amazing. Thanks for all you do.
Thank
So
you.
regarding that, what will be your challenges? That's a lot. Yeah.
Um, I would say my challenges would be it's hard to be a researcher and a clinician because those are like, two different hats. So although I'm giving exercises for my, randomized control trial study, it cannot be counted as physical therapy. It's different. So I have to be very careful, when I say things to my research participants, whereas it's a different world when I come to my home health setting and when I speak to my patients, because it's like a PT license hat that I wear when I come outside and, do physical therapy. And in the research side, it's a lot different. So sometimes it's kind of hard to switch, language and think a little bit before you say something. And yeah, and it's a challenge. I'm sure you know about it as a home health clinician driving around to patients'
Yes.
homes.
Mm-hmm.
That's one of the biggest challenges. Yeah, so
Yeah.
far those are the challenges, I think.
That's true. Kudos to all the researchers. I've interviewed many physical therapists already, academicians, PhD, and also more on inclined in doing research proposals. So I even have colleagues, very like Dr. Amy Jaspar, Dr. RV, and then Mariana Winggood. They're doing all research and a lot. Shout out to all of you. So, what are the skills we need to learn and we need to improve? Do you do like read some books to learn more, courses to if you want to do research?
So I would say if you're a clinician and if you want to start out, in research, it's a great opportunity because the way I look at it is everything that, they do in research comes out, published in papers, and that's what we practice, right? So just being in the forefront of research is a great, amazing experience because then you can culminate both the research experience and your clinical experience, and the patient gets the best out of both worlds, right? So the way I approached this role that I'm currently in is I live very close to Stanford University. So I approached one of the professors because my niche is like fall prevention and balance. So I was like, looking up online, what are some of the, research studies in Stanford related to balance and falls? And I got like a bunch of studies, and, it doesn't have to be exact, but at least in the same line of work that you want to do. It can be like a broader area, and you can just, try to email, if you have that professor's email and say, hey, I'm interested to see what you guys are doing. This is something that I have been working as a physical therapist also. Geriatrics is my passion. So what do you think bringing me in as one of your researchers? So I think that's how you would start a conversation. And then that brings up, opportunities. Sometimes they might say, I don't have funding right now, but I know a colleague, that is doing similar research. I can connect you. So you will be connected with different people, and that's how you will know what you want to do next.
Yeah, good to know. So having a mentor and also connection. So that's good. Yeah, because right now, do you think having or being involved in some research study, like a survey, asking some suggestion from the researcher staff itself, also good, like to be involved from the
Yeah.
beginning? Ah, okay.
Yeah,
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 that's good.
absolutely. I think surveys are like one of the modes of doing research where you
Mm,
get
yeah.
patients' input. So it's a valuable information.
Yeah, that's what I receive nowadays. Some asking some survey and then some ideas. So that's really good. But I really applaud all of you, especially when I see CSM. They have the papers, a white paper, proposals, and then later on
Uh-huh.
publishing. So we would love to learn more later on. And I believe this is skills that you have from research. The AI Agewiser was born. So
Yeah.
I met you in Technopalooza in the ALI, and we talked about this recently. So for our listeners, clinicians, and patients or clients, can you tell us more what is Agewiser? We want to be
Yes.
wiser while aging. So I know that's where you got that idea.
Yes, that's a great statement, and I like how you put it together, Dr. Jenny. So, Agewiser is a senior care application that I envisioned. It's going to improve falls in older adults, improve their overall aging. So, the way I kind of put it together is by using the geriatric care model, where we have like those 4 M's, and each M actually stands for very significant um, you know a very significant care later, which I'm going to explain. So the first M is mobility. So as a physical therapist, if you're a clinician, you know how important mobility is, and we all know 150 minutes of exercise, moderate intensity, all of us have to do in order to be healthy and age gracefully. So, with that in mind, I created the mobility component where I added about 200 videos to improve balance, prevent falls, help improve strength, and overall ability to do things independently. So that's the mobility component that we have as part of the, very first, I would say, first approach. The second approach that I took is improving their mind, meaning it's the cognitive aspect. So if we have cognitive decline, then we have a higher risk for falling, right? So improving our cognition through crossword puzzles, through games, something that can keep that brain sharp is important. So that second M, I focused on mind. So I included some games in this app, which can help improve that cognition. And thirdly, we have the medication aspect, which is again a super important component of older adults, well-being, because if they're not taking right dosage, or if they're taking, high dosage without knowing, sometimes, or a lot of times it happens actually. And if there are like cross effects from, each other, like the drugs, right? Or even when the physicians prescribe these medications, sometimes they miscommunicating with each other, and they might be getting 2 doses of aspirin, or 2 doses of ibuprofen, high dosage, which is not good for the patient. So in order to tackle the side effects of the medications, what I've done is I have integrated this software into the app, where when they create their profile, they are going to input whatever medications that they're on, and all the medications will run through the software, and it will look at if there is any cross effects, if there is like any high dosage alerts, and it would automatically be connected to the physician on the file, and would be alerted to the physician, hey, take a look at this drug, this doesn't seem right. So that's when the physician can take an action immediately. So that way, if the patient has, maybe high blood pressure medication dosage, And if that's not taken care in time, maybe they'll have a fall because of, sudden drop in the pressure, right? So
Yeah.
maybe a fatal event can be prevented. And the last M is the what matters. So what matters most, it's hard to say this is what matters most to everybody. So what I did was I took social networking as one of the matters M. So I put like a dumbed down version of Facebook where seniors can actually interact with each other, and there is that social
Nice.
connectedness piece.
Mm-hmm.
The seniors will be like, hey, I have back pain today, or maybe, something else that they want to share, and they want to know what others are doing for the same problem. Or it could be something like joyful that they want to share. I don't have no back pain anymore. I am taking care of my grandchild. So
Mm-hmm.
something like that.
Nice.
So it's kind of like an interaction thing. And we have a virtual caregiver also that's incorporated in the last M along with the Facebook, and that is called Virtual Caregiver Gen. So Virtual Caregiver Gen is always running in the background, on your phone or your tablet, whichever device that you're using, and it's going to interact with the senior as if like a person that's sitting next to you. So, you can ask Jen, hey, Jen, I'm not feeling too good. What can I do right now? And, Jen will respond, hey, these are some of the activities that you can engage. Or Jen can be like, your music player, play my favorite music, right? I mean, you can use Jen because that's like a chat GPT model that we are using on the back end to get all these questions answered. And it's since it's AI powered, it's going to take all of the information that it already got before. So all of that is linked, and it's going to make connections and see how it can give the best answer to the caregiver, I mean, to the patient. So it's not like, you get like a robot answer, but
Mhm.
it's very well connected with what you have been searching, what it has been observing as patterns, and it's going to give you those smart answers.
That's really nice. You really cover the 5 M's from the
Yes, almost.
CSM. And that's
Yeah.
why I feel tired recently. There's something on the back of my mind always calling me Jen, Jen. So that's I'm there.
There you
Caregiver,
go.
virtual caregiver Jen, do this. I'm now
Uh-huh.
Alexa.
You are.
Is it Jen as in J or Jen as in generations? GEN.
So JEN is what we
Okay.
have now.
Why
Uh,
do you think of Jen?
so that's Jenny.
So I'm one of the inspirations there. So
You
I'm
are.
virtual caregiver Jen. Yeah.
So
I
you're
think
also playing a role in Agewiser.
yes, yes, thank you. At least that's a nice name.
For sure.
I is that the part when you showed me that they can see their relatives? Like you remember you showed me the picture
Yes.
like they're
Yes.
talking about
Yeah, I
see?
can actually share
Yes.
the screen if you want.
Mhm.
Let me share the
Yeah, so they
screen.
have an idea, at
Mhm.
least so it's an app that they need to install, right? Just like a normal app.
And
Yeah,
what
like that.
Yes. And what I can do, Jenny, is I can actually post links after
Mm-hmm.
our
Yeah.
meeting today. So
Mm-hmm.
that way people can actually look at how to download, how to, use the app.
Yeah.
So
We can
um
make another like only about Agewiser in the future, Yeah.
awesome,
At least
awesome.
this is just like an overview that this
Overview.
exists. Yes,
Uh-huh.
yes. And that's
So
link is very beneficial.
sure, sure. So this is just the 4 M's that I was talking about. Mobility,
Mhm.
we have about 180 plus videos. We have brain games in mind,
Mhm.
and the medication manager, and we have the AI powered caregiver. So let me show you the video of
Mhm.
how it's going to work.
Nice. Congrats.
Oh, thank you.
How many years or you do this like in the
Um,
process?
Actually, I would say it took like about 2 years or
Wow.
even more. Yeah.
Great. Mm-hmm.
Mhm.
Congrats. This is
Thank
amazing.
you. Thank you. Uh,
Welcome.
this is the PDF. Let me open this one. Okay. Okay, so this is how it looks,
Mm-hmm.
where they can just talk to the person.
Tahoe is a beautiful place with lots of activities year-round. Since we're in spring heading into summer, you might find these options fun. 1. Hiking.
So I just want to say what I'm doing here. So that's my son that I put the avatar as. So you can set your avatar, whoever you want to set your avatar, like, you know, your spouse, your, you know, son, your daughter, whoever you want. You can set the avatar and name them. And you can basically ask any question. And right now, the question that's running in this video is, what can I do in Lake Tahoe? And the answer is actually not coming from ChatGPT, but your loved one is actually talking to you. That is,
Mm-hmm.
right now I have my son talking to me. You know, I just uploaded his picture, but it comes as a video, like a person talking to you, and it just feels like the person is sitting next to you and you're having like a regular, normal conversation.
But I didn't see the video. I'm still have the 4M.
Oh, you still have the forum?
Yeah, I
Okay.
think you have the, but I heard the sound of
Oh,
him
you
talking.
heard the sound. Let me share the right
Mhm.
one.
Yeah, I
Oh,
think it should be.
okay.
Ah, okay, gotcha. So
Okay.
this is the
Round
one.
Hammock. 2. Biking. Hit the bike trails or go mountain biking if you're looking for something more rugged. 3. Water sports. Go kayaking.
You know, I mean, the voice might sound a little odd because there are like some generic voices that you can put male and female. However, we are even trying to, you know, see if we can add custom voices. If we have like a 30-second clip of somebody's voice, we
Okay.
can clone and make it like they're almost near voice of your loved one, right? And
Yeah,
then
I
we can
see.
attach that so it becomes more like a person that's talking to you. However, I think it will take a little bit of time for us to, you know, get to that point. Right now, we are like, you know, starting out. So this is the, you know, model that we have at the moment.
That's really good because
Mhm.
you really touch everything like the medication part, mobility.
Mhm.
This is important. You have the exercise because we have many apps only for mobility and different exercise, right? And
Yes.
then you also already include the 5 M's. Also the brain. I really like that. We just talk about the dementia in the CSM, and
Mhm.
then we really want those mind games. And this is you put also some part of that. I'm
Mhm.
using the clock yourself for balance, and that's good for the brain, but you
Right.
mix everything, and
Mhm.
there's like correlation with that medication. They can
Right.
make their own group, Facebook group
Right.
with that socialization.
Exactly.
Congratulations. We
All
would
the
love to
seniors.
learn more about this. Yeah.
Sure,
So
sure.
how can they download or yeah, download, right? They will get the
Yes.
app. Yeah.
So I can actually send the link to you, Jenny. Maybe you can post it
Yeah.
under the
Yeah.
you know,
When we
Zoom
post this.
meeting.
Okay.
Mhm.
Mm-hmm.
I will send you all those links where they can see how the app works. So it's very easy. We created these links where when they click on each link, they know how to exactly navigate the app, what the app contains, you know, where to go for exercises, where to go for, you know, games for their brain, where to add the medications. Everything is like very clear. And if we also have like a customer support, if they need, you know,
Yeah.
any questions to be answered. So yeah, I mean, feel free to reach out. We would love to help as many people as we can. Right now, we have a beta testing going, which
Mm-hmm.
means we are testing the app and we want to get feedback from people. We would love to hear if there is anything that would be more helpful, you know,
Mm-hmm.
anything that needs to be changed, you know,
Mm-hmm.
font, color. We would love to get that feedback because this is going to be released in March. So,
Okay. This coming
you know,
March,
it's this March, yeah,
next week.
2024.
I
Yeah,
see next
yeah.
week.
Uh-huh. So March, I think March 14th, we are looking
Okay.
at the second week of March. So, you know, we would love to, you know, hear from people that are using it. So it'll be nice to, you know, make those changes and make it better and improve the app for the betterment of,
Okay.
you know, quality of life.
Good, good. Congratulations. So when you say beta, they can download the app. It's free for them to give input and everything, right?
Yes,
So they
yes.
can test. And
Mhm,
is
mhm.
this for clinicians or any public can try the beta testing?
So public can try the beta testing. For clinicians, it's a little tricky. You know, they can try to see how the app works, and if they like what the app is doing, they can recommend to their
Yes.
patients. This can be your home exercise program. These are
Mm-hmm.
your exercises that you can try, because
Mm-hmm.
all the videos that we created have like the multimodal components, like balance, aerobic section. Then we have strength, we have flexibility, all four.
Mm-hmm.
And every day, the person using the app gets recommendations on 4 modules. That is
Okay.
balance, strength,
Yes.
aerobic component, and flexibility. So there's
Coordination.
nothing that they're missing. And as you know, working out on all 4 modules is the one that's going to help you, improve everything in like to keep yourself healthy, right? And
Yes.
act.
Definitely, I can try that
Mhm.
anytime this week. So
Sure.
because now I will learn where how to upload download it, you know.
Download.
So
Mhm.
when I open it, because when I do the clock yourself, I use my phone and we do exercise on the spot. So I
Right.
can click one of those exercise and we can do it together because I'm now
Yes.
in a fit setting. And then when they
Uh-huh.
discharge, I can just tell them continue and this is how it works. Okay. So
Exactly.
that's really good. Thank you. This
Sure,
is
sure.
another great innovation. So thank you so much, Swathi. How can they connect with you?
So I can put my email ID. I have 2 emails. One is the Agewiser email and the Gmail. They can connect if there are clinicians that want to connect with me. Please feel free to reach out on LinkedIn, or
Mm-hmm.
you can feel free to email me. Anything is fine. I would love to network with more clinicians to see how we can make this a better app, so we can
Yeah.
also, serve the therapists in general, to see if they
Yes.
need, something from this app. Maybe we can, slowly add more features to it, right? And
Yes.
then
Yes.
patients, obviously this is more patient centered, so we can hear what their feedback is
Mm-hmm.
to of the app.
That's really good. Thank you
Mhm.
so much. So what's your tips for them? Everything is here so far. So what's your short tips for our listeners, especially
Mm,
our balance and fall support group members? They are
yes.
clinicians or patients.
Okay, so no matter you're a clinician, patient, enjoy what you're doing in life. Life is very short.
Mm,
Stay active, be there for your kids as long as you can, and for which the mantra is, again, staying active, eating healthy, less stress. Obviously, that's the most difficult part of all, not
yeah.
stressing out.
Yes,
uh,
yes. Mm-hmm.
and yeah, spend time with your kids, and don't work too hard.
Yeah, I think you have two kids, I remember, right? They're two,
Two
right?
kids,
Yeah.
yeah,
So
7 and 9.
us is there. I have 14 years old. She's big now.
I remember, yes.
Yes, so thank you so much. These are really, really great. We really salute and kudos to clinicians like you because you're very good clinician already, and there's another hat for you to innovate, which will benefit us clinicians for our patients, you know. So thank you, and we appreciate you so much. Yeah. So guys, we can close this one so at least they can see you again. You can
Oh,
stop sharing your screen and
oh,
then
sorry.
definitely. So guys, here's Swera. So she's a geriatric physical therapist and then she has this Agewiser. So congratulations again. If you have any questions, guys, you can connect with Swathi. And then if you have any feedback, so connect with me as well. And then we are in balance and fall support group. Anything that we can connect and collaborate. So we are all here as your geriatric clinicians, physical therapists. So for the benefits of our patients, right? So it's another amazing, thanks God. It's Thursday. Congratulations again. So more power, and we will definitely support that. And of course, that benefits us as well, because if we know more, the updates, the things like innovations, technical, I met many innovative robotics for strokes, right? So that's really amazing with technology nowadays. So guys, if you
Yes.
have questions, connect with us, PhysioGen PT and Wellness, Balance and Fall Support Group in Aging Adults. And we have great collaboration with these amazing therapies. Bye for now, guys. Thank you so much, Swathi.
Thank you so much for connecting me here, and thank you for supporting Agewiser. Take
You
care,
are
guys. Thank
welcome. I
you.
thought you will tell me, thank you, virtual caregiver Jen.
Thank you, Jen, virtual caregiver.
You be able surprised when you say, thank you so much, Swathi. Thank
All
you
right,
so
thank
much,
you.
guys, and
Bye.
good night or good morning wherever you are listening. All right. Bye for now, guys. Appreciate you always.